If you've been living with chronic pain, the kind that lingers for months, limits your activity, or keeps returning no matter what you try, you may be wondering whether shockwave therapy could finally give you the relief you deserve. As one of the leading regenerative therapies in St. Louis, Shockwave has helped countless adults get back to the activities they love without relying on pills, injections, or surgery. But you might still be asking, is Shockwave therapy right for me? Hello, my name is Dr. Beth Templin, and I am the CEO and founder of HouseFit, and that's exactly what we're going to explore in this video. As an expert in aging and regenerative medicine, I want you to feel empowered with clear, honest information about whether you're a great candidate for this advanced treatment and when it may not be the best choice. By the end, you'll have a confident understanding of who benefits most from shockwave therapy and what your next steps should be. Before we talk about whether you're a good candidate, let's do a quick review of what shockwave therapy actually does. Shockwave therapy uses high-energy sound waves to stimulate healing in areas of the body that have become inflamed, irritated, or simply degenerated over time. These sound waves increase blood flow, reduce chronic inflammation, stimulate collagen production, break up scar tissue, and trigger a powerful regenerative response. In other words, shockwave helps your body to repair tissue that hasn't healed well on its own. And that's why it's especially powerful for aging adults and for people stuck in chronic pain who have tried everything, yet still struggle with the same issues month after month. If this describes you, keep on listening. You may be an excellent candidate. So not everyone needs shockwave therapy, but the people who do often see incredibly meaningful improvements. Here's who benefits most. People with chronic pain that won't go away. So if you've been dealing with pain for months or years, you're in the prime category for shockwave therapy. This includes long-standing issues such as heel pain or plantar fasciitis, Achilles tendon pain, knee arthritis, hip bursitis, shoulder or rotator cuff pain, tennis elbow or golfer's elbow, thumb or wrist arthritis, chronic muscle nuts or trigger points, old injuries that have just never healed right. Chronic pain often means the tissue is stuck in a dysfunctional cycle. It's not getting enough blood flow. It's got poor collagen structure, ongoing inflammation, or even scar tissue buildup. Shockwave effectively resets this cycle and kicks your healing process back into gear. 2, people who haven't responded to other treatments. So many of our clients come in frustrated because they've already tried physical therapy, chiropractic care, rest, NSAIDs or other pain pills, steroid injections, orthotics, ice, heat, braces, stretching or massage, and they're still feeling stuck. If that sounds like you, there's hope. Shockwave therapy is specifically designed for cases where the tissue hasn't healed properly and needs more direct regenerative stimulus. This is why we see so many breakthroughs in clients who were told nothing else can be done. We work specifically with adults 50 plus who want to stay active and independent. So shockwave therapy is one of the safest and most effective regenerative treatments for aging adults, especially those who want to stay active, mobile, and independent without relying on medications or surgery. As we age, our tissues naturally lose elasticity. They lose hydration and blood flow. This makes injuries slower to heal and chronic pain becomes more common. Shockwave helps to reverse these age-related changes by improving your circulation, stimulating collagen, reducing chronic inflammation, strengthening the tendons and ligaments. This makes it an excellent option for people who want to move with confidence and avoid losing the activities they love, from daily walks to pickleball to gardening. We help people to avoid surgery or to get off long-term pain medications. So many adults want relief, but really aren't interested in repeated steroid injections, joint replacements, arthroscopic procedures, long strings of medication, which only mask the pain instead of solving it. So if you're looking for a natural way to heal, one that promotes true tissue repair, Shockwave offers a safe, evidence-based, and non-invasive alternative. And in many cases, it helps people avoid surgery altogether. We help people that are seeking fast results. So while traditional therapies often take months to show progress, many people experience noticeable improvements after just 1 to 3 Shockwave sessions. So if you're looking for faster pain relief, improved mobility, better strength, a quicker return to activity, Shockwave is designed to accelerate recovery. Most of our treatment plans involve 6 sessions, with the improvements continuing for up to 12 weeks after your final visit as the new tissue forms and strengthens. So while Shockwave is highly versatile, some conditions respond especially well. These include plantar fasciitis and heel pain. It's actually one of the most researched and successful uses of Shockwave. Symptoms it really helps to manage are things like morning pain, pain after walking, and heel tenderness. Another one is Achilles tendonitis. So Shockwave delivers energy directly into the tendon to stimulate healing. This is great for runners, walkers, or adults with chronic tightness. Another area it's really effective in is rotator cuff issues and shoulder pain. This is especially effective for calcified tendons and helps with raising your arm, reaching, lifting, and most importantly, sleeping comfortably. This is fantastic for knee arthritis or patellar tendon pain. Shockwave improves tissue quality and reduces inflammation around the joint. It's helpful for hip bursitis and gluteal tendinopathies. So it's able to treat that deep, stubborn hip pain, and it's one of the most top reasons people seek Shockwave treatment in St. Louis. It's great for tennis elbow and golfer's elbow, strong research to support both conditions. And then also in hand, wrist, and thumb arthritis, we're seeing a growing use, especially when paired with EMTT. It's also used for trigger points and muscle knots. So Shockwave quickly releases the tight and irritated tissue, and we can use it for post-injury scar tissue. So old scar tissue can finally be broken up and remodeled, reducing pain and restoring function. So if you hear your condition on this list, you're likely a prime candidate. On the flip side, who's not a good candidate for Shockwave therapy? So while Shockwave is safe and effective for most adults, there are certain situations where we recommend against it. You may not be a candidate if you are pregnant, if you have a bleeding disorder, if you take certain blood thinners, if you have an active tumor or active cancer in the treatment area, if you have an active infection, certain pacemakers we need to stay away from, and these precautions are based on safety guidelines. Don't worry, we screen carefully during your consultation to ensure Shockwave is the right choice for you. So why do aging adults do exceptionally well with Shockwave? Well, one of the most exciting things about Shockwave is how effective it is for adults over 50. As we age, we naturally experience slower healing, decreased collagen production, more stiffness, reduced circulation, increased inflammation, and Shockwave directly addresses all of these issues. It gives the body the energy and stimulation it needs to repair itself, something that becomes harder to do naturally over time. This is why so many older adults tell us, I wish I had done this sooner. Shockwave doesn't just reduce pain, it improves function, strength, mobility, and quality of life. So how do we determine whether you're a good candidate? Well, at HouseFit, we use a detailed assessment process that includes understanding your pain history, assessing your mobility and strength, identifying underlying dysfunction, evaluating tissue quality, reviewing past treatments, screening for contraindications, and discussing your goals. We provide a free consultation so that you can get all of your questions answered and see whether this treatment aligns with your needs and expectations. Our goal is simple. Choose the treatment that sets you up for the best possible success. Sometimes that means Shockwave, sometimes it means EMTT, sometimes it means physical therapy first, or a combination of all three. If you're ready to find out if Shockwave is right for you, if you're tired of living with pain, tired of feeling limited, or tired of hearing that nothing else can be done, I want you to know there are options. Shockwave therapy has helped thousands of adults regain comfort, mobility, and confidence, often when nothing else has worked. So if you're curious about whether it could work for you, schedule a free consultation today and come see why so many St. Louis adults trust us for their regenerative care. We want you to start moving towards a stronger, more active life. You deserve to feel good in your body again, and we're here to help make that possible.